Devastating toll on Canada's seniors. Deadly outbreaks sweeping across Canada's nursing homes and long-term care facilities. Federal officials to provide an update today on measures for seniors. But in Dorval, Quebec, there are now 3 separate investigations into a privately owned long-term care facility where 31 residents have died. Montreal police and the Quebec coroner's office trying to determine exactly what unfolded at Résidence Saron. The 31 residents died in under a month, and at least 5 of them from COVID-19. The cause for the others, not yet known. There are allegations residents were abandoned by staff, left to fend for themselves without food, water, or basic care. Let's bring in the host of Power Play on this. Evan Solomon joins us now from Ottawa. Evan, tragic news coming from really different parts of the country, but in Quebec in general. What are we expecting to hear from Ottawa on how they're going to deal with the special situation of seniors?
You know, officials know the old saying that a society is judged by how they treat their elderly. And this COVID-19 crisis has exposed how vulnerable our elderly are in long-term care, both the public and the privately owned ones. What's happened at that private care place in Quebec, in Dorval, which the Montreal Gazette described with the term concentration camp, I think is eye-opening, jaw-dropping, tragic, and horrific. So we already heard in the last number of days that officials will come forward today. So what do they want to do? You know, they talk about putting an iron ring around these things. One, they've got to make sure that staff are properly compensated, because there's already a war between some care facilities where workers who are in great shortages there, and that's what we've seen, are moving to other facilities because they're paying, you know, $30 an hour. So one, on wages. 2, they lack personal protective equipment. This has been the story of the crisis, and it's the most acute in the hotspots of long-term care facilities. So they need to make sure they've got personal protective equipment for the staff. How do they isolate? What about volunteers that are coming in to feed? So to feed the people there, the federal government will put in protocols, probably some funding today. Look for that. Remember, a lot of this stuff is provincially regulated, but the federal government has a role to play in setting standards and also giving key support, as too many people are dying in tragic ways. And just that clip that you heard, you know, this is stuff you never thought you'd hear in Canada, but we are hearing it all too often.
Yeah, you mentioned this, but I just want to emphasize the point that some of the provinces are saying, look, if you're a healthcare worker, you can't work in more than one facility right now because we don't want the spread to continue, especially in these health compromised situations. But then, of course, that means some of these places are left without workers at all, or half the staff, and trying to move on. So it's one thing to say, we're going to lock it down, but another not to have the resources in place to make sure that still means people get care.
And also, we couldn't blame these workers. A lot of these workers are scared. They're going into a place where people are dying, and they have to make a terrible choice. Am I putting my life in danger to help someone else's life when the protocols, the equipment, and maybe the pay is not there? So, look, was there negligence? There's criminal investigations going on in Quebec, and clearly there was some horrific acts of negligence of human beings, Canadians, who were left in terrible situations. But we've got to get a better system of monitoring, transparency, equipment, because, again, much like happened to the cruise ship industry, navies, any kind of isolated place where people are in close proximity, certainly with compromised immune systems like in a long-term care facility, you are going to get a hot zone. And they have become the critical place. So look for that with the COVID-19 committee. We should say Justin Trudeau's not speaking today, but that will be one of the key focuses of today's conference.
All right. Yeah. And those folks, you know, they're just defenseless, right? A lot of them cannot care for themselves in any manner. So they really have to rely on those around them. Evan, thanks for the update. We'll talk to you later.